Well, the Ministry of Health, Wellness and Nutrition, as you're aware, have temporarily closed the facility to allow for an intervention in this regard. The Environmental Health Division and of course our team, our vector control team, is combing this facility, doing an assessment, more or less looking for the prevalence of bedbug or the presence of bedbugs within the facility. That is accompanied by a measure of treatment as well within the facility and the areas identified. That kind of the treatment ranges from heat treatment. We're using steamers to steam the chairs and other areas that where infestation has been noted. Bedbugs can be very, very hardy, and I need to make it clear that not necessarily that the bedbugs originate within the facility, but they can be carried into the facility because it's a high traffic area where in fact we are saving patients and persons are moving. Bedbugs can be found in a number of areas. They are known to have inhabit or to infest 5-star resorts, accommodations. They travel through the airports. So normally they take a ride, they hike on persons. And I want to dispel that. Not having said that, or having identified bedbugs in some of the chairs that and in the areas that are being treated, it doesn't necessarily mean that it originated from there. And so having said that as well, we are putting measures in place to ensure continuity in terms of monitoring over the we are training our staff, both staff of the facility, and we are putting in place we are building redundancy within our system to continue to monitor and to treat, because it does not mean that a one-time treatment may necessarily solve the problem in its entirety, because it can be coming from community and other areas and come into the facility. So we need to bear that in mind. Bedbugs, they live in close proximity to their host, which is human in most of the cases. So they typically bite, and they do so at nights most of the time. They are very active between the hours of midnight to 5 in the morning, more or less when their host is really sleeping. But notwithstanding that, with infestation, as we can see, they could be in bedding, they can be in chairs. When infestation are high, they can bite during the course of the day as well, because a blood meal for them is really necessary for their survival. That's what they use. If they don't have a blood meal, they really cannot reproduce. So that is why they always live in close proximity to their hosts, which in most cases are humans. When you talk about the risk associated in terms of health risk, they are not known more or less to carry a lot of diseases, but it can cause the bites. You can have bite marks, you could have rash. It may cause, in severe cases, allergic reactions, of course, which physicians can perhaps prescribe something for. Bedbugs can be very, very hardy and sometimes can develop resistance to chemicals that are being used. And of course, it therefore means sometimes, depending on the use and reuse of chemicals, it can become ineffective in the treatment of bedbugs. Notwithstanding that, one may ask, where do they inhabit? They more or less live within crevices, cracks in walls, in the springs of bed, in box beds, in the seams of mattresses, seams of chairs, any crevices in the chairs or walls on the on boards around the beds and so on. So they can live in those areas. So even sometimes the treatment may not reach all of the eggs, and they can lay eggs, and it can be very difficult a situation to manage. But given what is going on, heat treatment, of course, is very good. In some countries, they may use the can freeze. But for us here, with the Environmental Health Division, we are using heat treatment. And we are also using chemical treatment to be able to manage it. One of the things that are very important to be able to identify bedbug infestation, even within the home setting, one needs to be able to inspect and to be able to identify, because management of it comes first with the identification of you having a problem. Of course, you need to inspect the seam of your chairs, seams of mattresses. You may be able to see they normally have a molting phase, or they have an exoskeleton. You might see that within you might see blood marks on your bed. You might see dark stains of blood. So these are all signs. You may see the eggs on the seams as well. So these are all signs that you may have an infestation that you need to deal with. But notwithstanding that, some of the domestic insecticides that we use can deal with them, but we need to be careful even within the home setting where we have, and even for our pod health services in Environmental Health Division, Ministry of Health. That is why sometimes when members of the public are importing mattresses here, they need to be fumigated. Use clothing if you're getting used clothing, if you are getting used bed sheet. All of those things can introduce bugs into the home setting. Notwithstanding that, even travel through airports, coming in with your suitcase, they are at airports as well. And as you commute through airports, these are high trafficked areas. They can hike a ride to another destination, and they can continue to grow and to proliferate in those areas as well. Precautions to be taken by householders, more or less, and in the coming weeks, we will do a little more on public education. It starts with identification. If you are not able to identify that you have a problem, you may have a major infestation. And sometimes that can be, bedbug problems can be very, very costly, because depending on the extent of the infestation, you may have loss of furniture. You may have to dispose the mattress because it can be so heavily infested that it does not make much sense treating it. But when simple things we can do, we're traveling, you don't get that suitcase all the way to your room before there's clothes that you wear. You need to get it to the machine, wash it in hot water. If you have a dryer, you could dry it in there. Even drying in sunshine, the sun, they don't like heat. You could put your clothes out as well. But these are all measures that one can take in terms of preventing the introduction. And we spoke of used mattresses, used linen, even sometimes ironing of those things. The heat in ironing can destroy the eggs as well. But constant inspection and cleaning. I must say, a lot of times persons may want to associate bed bugs with insanitary conditions. That is not necessarily the case. A place can be appears to be very clean, but yet infested. But however, frequent cleaning in terms of vacuuming, because they can be under the skirt boards and so on, vacuuming can suck them up, and frequent cleaning can help mitigate. But it doesn't mean that in sanitary conditions. Under very sanitary conditions, perhaps maybe you can still have bed bugs present, because remember, they can just hike a ride on your clothing or your bag, your luggage, and they can get into those premises. Well, the Environmental Health Division has a broad mandate when it comes to public health, and bedbug can be considered a pest or public health significance, given what it can do. So we will continue with general public education and to provide support in community. And if we, once members of the community are able to identify, or if they need help in identifying infestation, we do that as well and provide a level of treatment within various settings. But the continuous education on bedbug is one that we always do, but we are going to more or less, given the prevalence of it, not only in developing countries, but in the developed world as well. It is something that we need to, of course, continue to educate members of the public on identification, what measures can be taken, and and what support can be provided from our end in ensuring that this is put under control. Well, someone identifying that, if someone have identified, that they have a problem, the Environmental Health Division is always available to provide guidance and to, in this regard, if we have to assist, we do that. That is something that we do all the time. As I indicated, we will be providing more information as to how to identify it and the measures that can be taken within the home setting once there is early identification to prevent huge infestation that as I mentioned, that can sometimes be costly. Depending on the infestation, it can destroy furniture. It can be too extensive, perhaps, to save a piece of furniture and a mattress and so on. But we'll continue to work with members of the public and to provide public education and to assist in any way that we can from a public health standpoint to ensure that this is suppressed.